All right, welcome future EMTs. Today we're going to get into the weeds of the National Registry exam category of trauma. We'll go over 10 questions in detail. We'll explain the right and wrong answer choices and common pitfalls of these questions. So grab a piece of paper and be prepared to pause the video so that you can come up with an answer on your own before we get into the details. Good luck. You might know this already, but just in case you don't remember, the NREMT cognitive exam is divided into 5 content categories. Trauma is one of them. So each question falls into one of 3 categories: recall, application, analysis, and so we'll give you a few of each question. Let's get into it. Question 1. Which of the following is a sign of hypovolemic shock? A. Warm flesh skin. B. Rapid, weak pulse. C. Slow, irregular respirations. Or D. Bounding peripheral pulses. Pause here if you need a second. The answer is B. Rapid, weak pulse. Why? Warm flesh skin is more consistent with distributive shock, such as what we see with sepsis. B is correct because a weak rapid pulse is a classic early sign of hypovolemia. That's not having enough blood in the system, right? And so to compensate, you have a weak rapid pulse as your body tries to keep up. C is wrong because slow respirations occur in late stages of shock, and D is not correct because bounding pulses are not seen with low blood volume. The common mistake here is associating irregular breathing with early shock. Question 2. Which organ is most likely to cause significant bleeding when injured due to its high vascularity? A. Stomach. B. Liver. C. Kidney. Or D. Pancreas. The answer is B. Liver. A is wrong because the stomach is not highly vascular. B is correct because the liver is large and richly supplied with blood. It is a very dense organ. C is wrong because kidneys can bleed, but they're smaller. And so the more correct answer is B, the liver. D is wrong because the pancreas is not as vascular as the liver. The common mistake here is overestimating the bleeding potential of smaller organs like the pancreas or the kidneys. And so while this was an easier question, you need to make sure that you are choosing the best option. Medicine is a little complicated like that, and so there might be multiple that are possibly correct. You need to choose the most correct. Question 3. A 40-year-old male fell from a ladder and is lying on the ground complaining of severe back pain. He is alert, breathing normally, and has a stable pulse. What is your first action? A. Apply oxygen by non-rebreather mask. B. Perform a rapid trauma assessment. C. Manually stabilize the head and neck. Or D. Log roll the patient onto a backboard. The correct answer is C. Manually stabilize the head and neck. Why? A is wrong because oxygen is not immediately required without signs of hypoxia. B is wrong because assessment comes after spinal precautions. In reality, we'll do the assessment of the back very quickly as we're rolling the patient onto the backboard, just because that portion will be inaccessible to us once they're strapped in. But the key takeaway here is that the assessment is not the priority. C is correct because suspected spinal injury equals immediate manual stabilization. That's the priority. And D is wrong because log roll comes after stabilization and assessment. That could be confusing, but log roll isn't really a treatment. It's just a technique to move a patient. The priority here is to get them stabilized. And there's a variety of different ways that we can do that. Log roll is not always part of that, depending on what position they're in. The common mistake here is skipping spinal precautions to begin the assessment. That's really more of a risk that people might get wrong for a question like this. Question 4. A patient has a large open chest wound that is bubbling with each breath. What is the most appropriate initial treatment? A. Apply a dry sterile dressing. B. Apply an occlusive dressing taped on 3 sides. C. Administer oxygen and transport rapidly. Or D. Cover the wound with a non-rebreather mask. The correct answer is B. Apply an occlusive dressing taped on 3 sides. A is wrong because a dry dressing allows air to continue entering. B is correct because 3-sided seal prevents air from entering but allows it to escape. C is wrong because oxygen is important but not the first treatment. And D is wrong because the mask won't effectively seal the wound. The common mistake here is using a dry dressing or a fully sealing dressing on all 4 sides. The dry dressing is going to allow air to still come in, and the fully sealing dressing is not going to allow blood to drain, both creating pressure inside the chest cavity, right? And so we want blood that wants to come out, we want to allow it to come out, and we want to try to prevent additional air from going in because that chest cavity space is precious, especially at that time. Question 5. You are caring for a patient with a partial amputation of the hand. Bleeding is controlled. What should you do with the amputated part? A. Place it directly in cold water. B. Wrap it in sterile gauze, place it in a plastic bag, and keep it cool. C. Keep it dry and store it in the patient's pocket. Or D. Discard it as it is not salvageable. The correct answer is B. Wrap it up in sterile gauze, place it in a plastic bag, and keep it cool. In my class, I might give you some credit for keeping it dry and storing it in the patient's pocket because, I don't know, it's a funny thing to think about. Definitely not right. Don't do that. A is wrong because direct water contact damages the tissue. This is an amputated piece that we're not really qualified to assess whether or not it might be reattached, and so we want to preserve it as best as possible just in case it can. B is correct because this preserves the part without causing ice damage. C is absolutely not sterile and not temperature controlled and not a good idea because when the patient gets to the hospital after experiencing a trauma like that, likely they're going to have all their clothes cut off and thrown away. You don't want the ER staff to have to go digging through the trash because you remembered that the hand was in the patient's pocket. D is wrong because you always attempt to preserve amputated parts. The common mistake here is really placing the part directly in ice or in water, right? We don't want to freeze parts of the tissue, and we don't want to soak it in water. Question 6. A 17-year-old male was struck in the chest with a baseball. He collapsed and is now pulseless and apneic. What is the most likely cause? Not what do you do, what is the cause? A. Cardiac tamponade. B. tension pneumothorax. C, commotio cordis. Or D, myocardial infarction. The answer is C, commotio cordis. Why? A is wrong because tamponade causes obstructive shock, not instant collapse, right? That's blood pooling in the layer, right, that covers the heart. And so the patient would deteriorate over, some minutes. If it's very fast or even slower, would not cause instant collapse. That's probably the hidden wrong answer that you might be enticed to have chosen, and I can't blame you there. Tension pneumothorax shows progressive signs, not sudden arrest. Same sort of thing. C is correct because sudden blunt chest trauma during a vulnerable part of the cardiac cycle can interrupt and stop the cardiac electrical activity, the entire cycle. That's what would cause the sudden collapse. And D is wrong because myocardial infarction is rare in young, healthy individuals. With a trauma like that, you might show some signs on the EKG that can be debated left and right. That's out of your scope of practice anyways. Really, you're looking at commotio cordis because of the sudden blunt chest trauma. The common mistake here is choosing tamponade, like I said, due to chest trauma. Certainly could be a possibility for somebody that gets struck in the chest with a baseball, but because of the sudden collapse, we're thinking about C, commotio cordis. Question 7. A patient involved in a rollover crash is conscious but confused, with unequal pupils and vomiting. What should you suspect? A, alcohol intoxication. B, intracranial bleeding. C, diabetic emergency. Or D, spinal shock. The answer is B, intracranial bleeding. A doesn't explain why pupils are unequal, so that's wrong. B is correct because confusion, vomiting, and unequal pupils equals classic signs. C is wrong because it can cause confusion but not pupil asymmetry. And D is wrong because spinal shock would more likely involve hypotension and motor issues. The common mistake here is attributing symptoms to intoxication. If you work in a busy city with a large homeless population that you run on frequently, it's going to be a challenge, not difficult, but a challenge to remember signs and symptoms, and not only to be aware of those things, but to always be suspicious of signs and symptoms that could look like alcoholic intoxication or just intoxication from any alcohol or drugs, versus things like stroke and other issues that cause an altered mental status. Because sometimes when we have a population that is very commonly intoxicated, we might jump to conclusions there, and we don't want to miss something big. Question 8. You are called for a motorcycle crash. The rider has a deformed right femur and pale, sweaty skin. He is alert but restless. Vitals include a heart rate of 124, a blood pressure of 92/60. What is your priority? A, splint the leg and transport non-emergently. B, start CPR. C, treat for shock and transport rapidly. Or D, apply traction and reassess vital signs. The answer is C, treat for shock and transport rapidly. Why? A is wrong because splinting is needed but not before shock treatment and transport. B is wrong because the patient is not pulseless. C is correct because signs of compensated shock plus trauma equal rapid transport. Let's get it moving. D is wrong because traction is not used before treating life threats. The common mistake here is focusing on the fracture before the signs of shock. In this case, blood pressure that's not super scary low and a heart rate that's not super scary high might blend into the background, and you might start seeing the fracture before the possibility that this person is, getting shocky. And so, just keep your thoughts, keep your suspicions high, particularly for trauma, because you have a lot of systems at play depending on what happens. Question 9. A 25-year-old male was ejected from a vehicle and is unresponsive. He has snoring respirations and facial trauma. What is the best method to open his airway? A. Head tilt, chin lift. B. Jaw thrust maneuver. C. Nasopharyngeal airway. Or D. Oropharyngeal airway. The answer is B. Jaw thrust maneuver. And why is that? A is contraindicated with possible spinal injury. Yes, we do that with everybody else, but we have this different method specifically for possible spinal injury. B is correct because spinal precautions plus airway opening equal jaw thrust. C is wrong because NPA may be contraindicated in facial trauma. And D is not correct because OPA requires A, unconsciousness, and B, absence of a gag reflex. The common mistake here is using the head tilt or an NPA, both contraindicated in trauma. Question 10. A patient with a stab wound to the abdomen has a section of the bowel protruding. What should you do? A. Attempt to push the organ back inside. B. Cover the wound with a dry dressing. C. Apply direct pressure to stop the bleeding. Or D. Cover the evisceration with a moist, sterile, and occlusive cover. The answer here is D. Cover the evisceration with a moist, sterile, and occlusive cover. Why? A is wrong because you never want to reinsert eviscerated organs. B is wrong because dry dressings can damage exposed tissue. C is wrong because direct pressure may cause further injury. D is correct because moist, sterile dressing protects the tissue, and occlusive dressing prevents drying. The common mistake here is attempting to replace the eviscerated organs or applying dry gauze. Just remember, eviscerated organs, moist, sterile dressing. Occlusive dressing on top of that, if possible, or we can continue to moisten the dressing in transport with some sterile saline. Thank you for watching. I really hope you found these questions helpful. Please like and subscribe if you missed even one of these questions so that we can be more of a part of your learning journey. Ask questions in the comments and let us know your score. We'll see you in the next one.